Hi, I'm Dan Resnicek from Pacific Northwest Urology, and today we're going to show a video on how Urolift can be used for large prostates. With only 5 implants, we were able to successfully open the anterior channel of the prostate and significantly improve this man's urinary symptoms. A few years ago, Urolift increased the indications on the size of Urolift from 80 grams to 100 grams in size. What this means is they allowed the procedure to be used for guys with larger prostates. This opened up this minimally invasive procedure to a lot more men. Prostate size is important for procedures such as Urolift because the larger the size of the prostate, the more tissue that has to be retracted or opened up to allow the urine stream to improve. Some guys feel that prostates 100 grams in size are not a good option for Urolift, but what this video is going to show today is that the overall size of the prostate is probably less important than the configuration. An important factor to consider when looking at men with large prostates to see if Urolift would work for them is the width of the prostate. Length and height of the prostate are not as important, but width is a very important consideration. The most important reason for that is the width of the implant. The width of the implant is limited at 3.3 centimeters. So when we compress the tissue with that implant, it can't be much wider of a prostate than about 6.5 centimeters. After that, the implant will not reach all the way across the prostate. All right, so what we see here, we're starting off a very large prostate gland, large lateral lobe hypertrophy. He's got no median lobe, no intravesical protrusion. I'm going to start by placing my first implant here. And I'm going to pull back into the prostate. Again, seeing very large lateral lobes. It's actually kind of a shorter prostate, but I'm pulling back to the the distal prostate to the viru. And on his left side, I'm compressing the tissue and firing the implant. Once I've fired, I'm going to double compress. This double compression is something you'll see the rest of the video. It's something you probably want to do on a large prostate. What it allows is if the needle is not all the way through the prostate, a little bit more compression to allow that capsular end piece to grab hold on the capsule. And if you've overcompressed, it allows you to pull back if you've hit the bone. All right, so I've already fired one implant and onto the second implant. As you can see, this procedure is so fast, it's almost hard to give commentary on. So onto the second implant, I'm going to fire at the right side at the apex of the prostate. I went to the viru to make sure I'm at the apex. I'm compressing on the right side. And once I have enough compression laterally, boom, the needle's through. You can see me do the double compression technique again. And what you're going to see is some white fluid come out. That's some prostatic secretions. That happens when you've compressed the prostate appropriately. I'm going to wait for those to clear to see where I am. I can see the suture there. I'm going to advance that until there's a white line all the way across. That tells me I'm at 90 degrees. And the capsular end piece can be fired at that point. That means the tension of the device is just the right amount when you see that white line. So I put the scope back in the bladder. I've drained the bladder. And now on to the third implant. So third implant device is in the scope. I'm pulling back. You can already see a pretty good channel. And I'm going to go a little bit closer to the bladder neck or the proximal prostate. Here on the left side, I'm compressing that tissue. Again, I want to get a good amount of compression because this is a very large prostate. I've fired the needle. You can see that needle puncturing through the prostate. I double compress. I now tension the device. You can see the suture there. I'm going up to the white line and then firing the capsular end piece. Okay, back in the bladder. We're going to drain the bladder. And now for the fourth implant. That fourth implant is in place. You can see a great channel already anteriorly. And again, Urolift, you only want to focus on the anterior channel. And I'm going to go on the proximal prostate on the patient's right side or screen left. I'm compressing the tissue and already fired the implant there. Double compression once again. You can see the tensioning of the device and the capsular end piece is fired. All right, so I'm getting kind of a preview of what I need to do. It looks like there's a little bit more tissue I want to treat, so I'm putting on a 5th device implant. And because it's a large prostate, we fired a lot of implants. There is a little bit of blood, which inhibits the view here. But I'm trying to look where is the best place to put this 5th implant, and kind of assessing the prostate, looking at the patient's right side and the left side. And what we can see here visually is the left side is probably the obstructing side at this point. And it's not completely obstructing, but I do think an additional implant on that side is going to be beneficial. Because the view is not quite exactly what I want, I'm going to drain the bladder. And this is going to allow a little bit better visualization for me. I'm using that same implant. Now, once the bladder is drained, I'm going to pull back, again, get another good view. Where do I want to fire this implant? This is the apex of the prostate. I'm looking at the viru. And really, to me, it looks like on the patient's left or screen right at the mid-prostate is probably the last truly obstructing area. So making sure I'm not in the bladder neck, I'm pulling back to the mid-prostate, compressing that tissue on the left side at the mid-gland. And once I've compressed it appropriately, fired the implant, I'm going to double compress again. And we're going to get a good look at that suture. All right, at this point here, you can see the white line. That means it's tensioned appropriately. I fired the capsular end piece, the urethral end piece. And I'm getting a look here. I'm going to place the visual obturator so that I get a better view. And now you can see that the anterior channel is wide open. So now we're at the apex of the prostate, looking upwards through the anterior channel, and you can see all the way from the viru to the bladder neck, a wide open channel, only required 5 implants. So excellent result with only 5 implants with the Urolift device for a very large prostate, 96 grams. So size of the prostate is a consideration. The most important size consideration is actually the lateral width of the prostate because of the size of the Urolift implant. This can treat a very large prostate. There are certainly some prostates that are far too large for Urolift, but as we can see, as time goes on, Urolift can treat a lot more men, a lot more prostate anatomies than we originally thought. And this is a great thing. It allows guys that previously had to go on to more invasive procedures the option to try something a lot less invasive. And as you can see from this video, it takes 5 to 10 minutes to do the Urolift implant. We do it here all under an IV sedation, a very comfortable procedure, and a lot less invasive than other options. Hope you liked our video today. If you did, please click the like button below. Subscribe if you want to see more. Again, I'm Dan Resnicek from Pacific Northwest Urology.